Hi, everyone. Yes, I'm very excited. Today we will talk about how to become a forensic psychologist, but not only how to do that, also what it means to be a forensic psychologist, and yeah, what the day-to-day life is, what kind of different jobs you can do or different tasks you do. I think, at least twice heard the talk. I always learn something new. I'm always excited about James. Talking to us. I think we just chatted. We had 1 year off, but at the beginning of the last pandemic, we had an early conversation on Zoom, and I thought it was revolutionary to kind of do this on Zoom. And then I shared the audio with you guys, and I thought I'm really like breaking technology walls here, and now it's just like, of course it's recorded. I think that's the most asked question. I will not say much about James because part of the talks are always that he introduces himself, describes how he became who he is and what he does. So I think he does a much better job with that. But let me just leave it with that, James, that you're always one of my favorite, since this is recorded, one of my favorite speakers. Always excited to have you. And thank you so much for taking the time out of your schedule, because I know you're very busy. And so really, really appreciate it. And yes, please take it away.
Right, thank you very much for that. First of all, can you see my presentation?
Yes, very well.
Wonderful, wonderful. Okay, so I'm James Feller. I'm a consultant forensic psychologist, and throughout this presentation, you're going to learn a little bit about what that means. My present role is with this charity you see in the top right, St. Andrew's Healthcare. It's a large mental health charity, has a range of secure hospitals throughout the UK, mainly in Northampton. I work presently alongside the Probation Service and lead teams delivering mental health services to probation. People might be essentially sentenced to a mental health treatment requirement, and I lead the teams that provide that across the Greater London area and all of Essex presently, and that's expanding all the time. So it's a very interesting area of the work that we're doing. A consultant forensic psychologist is essentially someone who's advanced in the career. There's really no further to go beyond that, and you're going to see some levels that you can progress through. I'm going to go through the whole career progression, how you get there. Part of this presentation is also about why someone might want to become a forensic psychologist, and to some lesser degree, why someone may want to have some caution in pursuing the career, but it's definitely a rewarding career. It's also potentially a challenging career, emotionally challenging. And with that in mind, I'm just going to get started. By the way, there will be plenty of time for questions at the end. So don't worry, but please do jot down your questions. I'm very, very happy to answer very difficult questions. Right, so what is a forensic psychologist? Firstly, it's just the intersection between psychology and the criminal justice system. And that's the broadest possible definition. I put that out there because it changes dramatically depending on what country you work in. Here in the UK, it means something very specific. It has a lot of different career paths you can take in it. In other countries, for example, in Germany, it tends to be the case that there's a much larger focus on things like expert testimony. In the United States, I don't know if you can tell, but I'm from there, and in the United States, it is, again, much more focused on expert testimony and in secure hospital settings. And the prisons rarely have psychological interventions. I hope that changes, but it's not really the focus of it there. Someone who's qualified to the doctoral level or equivalent in psychology and is registered with the HCPC to practice as a practitioner psychologist in the forensic division. That is the strict definition of what it is. So in the UK, this is what it means. The HCPC is the Health and Care Professions Council, and that's the council that accredits and registers and monitors anyone practicing in psychology. So there are protected titles, like you can't call yourself a clinical psychologist, an education psychologist, or a forensic psychologist without their approval. You have to register with them. Up until the last 10 years or so, most forensic psychologists were not doctoral level people necessarily, but they had an equivalence, which was permitted by the HCPC based on what was very likely their career to date. So they will have probably become a forensic psychologist by going through work in prisons through an accredited program in the prison system itself. That's been changing significantly, and now it's much more like the clinical pathway where someone enters into a degree. It is possible to still register with the HCPC without completing the doctorate, and I'm going to get into how that works, but it's risky. and I'll answer all the questions about that. So what do they actually do? Work to understand criminal behaviors as well as the individuals doing those behaviors. Criminal behaviors, obviously, that's something that is a nebulous concept. It changes depending on the law. So a behavior is only criminal if it's criminalized by the society in which it's being behaved. So presently in the UK, if there's criminal behaviors that didn't exist, 50 years ago in the UK, things change. And that's the main difference when we're trying to compare forensic psychology practitioners to practitioners from other psychology disciplines, and that what we're dealing with is criminal behaviors. But that's really what distinguishes the need to specifically have a forensic psychologist. So someone could be presenting with many of the same things that a clinical psychologist would deal with, but part of those behaviors are criminal, hence you have a forensic psychologist present. So forensic psychologists work clinically in forensic settings. And it's often the setting that's most important in distinguishing forensic from other practitioners. And it's important to know as well that forensic psychologists don't have the monopoly necessarily on working in forensic settings. So the hospitals that we have in St. Andrews, our main one in Northampton, employs a combination of clinical and forensic psychologists, and they mainly do the same work. So here's a list of stuff, a list of things forensic psychologists do. So forensic risk assessments, those are things that, as the name suggests, creates a conclusion as to how risky a person is, how likely they are, in essence, to engage in certain criminal or other risky behaviors. So those are often performed within prisons as part of the parole process to determine the safety to release someone. They're performed on a regular basis in secure hospitals to determine what level of security someone needs, how much supervision they need. Forensic psychologists also provide clinical assessments that are non-risk related. It's important to note that those assessments are very likely to be used in forensic risk assessments. So if someone presents with a high level of anxiety in an anxiety-based psychometric test, which isn't necessarily a forensic test, that test can still be used in forensic risk assessment to say this person suffers from anxiety. It's a clinical dynamic risk factor. So that's something that can happen. But increasingly, forensic psychologists like myself are called upon to do other clinical psychology things. Presently, for example, I'm working with an NHS trust to provide neurodevelopmental clinics. So we perform autism, and ADHD assessments and a variety of other types of assessments that are not related to forensic risk and won't be used in forensic risk assessment. But because of the amount of clinical experience we have in forensic psychology and the shortage of psychologists in the country generally, we're called upon to do what's needed a lot of the time, and that's an example. Behavior profiles, yes, like on TV and in the movies, that is done. It's not done as often as the television makes us believe, but it does happen. And it's essentially about risk assessment, but with a future focus. And it's usually based on past behaviors. It's less often based on the type of person someone is or the upbringing they had. But it is still very much used to say, okay, this person's a good person to focus an investigation on. So when someone's doing a behavior profile, it is very unlikely that anyone will ever do one and say, okay, I've done my profile. The person who did it is Jim, right? We know exactly who did it because of the profile. No, it's like, is Jim a good person to spend other resources on focusing our attention when we really don't have any better way to narrow down the number of people we could be investigating? So if a population of 500,000 people has a serial murderer in it, and they're trying to narrow that number down to 5,500, et cetera, they might use behavior profiles to help with that. But again, there's a sense of chance in that because someone may not fit the profile. Expert testimony, this is in court. I've provided a lot of that, and in the parole board. And really it is what it sounds like it is, but it tends to be that rather than someone come in and provide just their opinion, they will have very likely done an extensive assessment on this person, written it up, big, thorough thing, and then turn up and essentially defend their report. And it's often the case that, yes, much like media would suggest, there is an expert on either side. And it goes a long way to show how many different opinions and how flexible these systems can be. Clinical intervention, a significant amount of what we do now is clinical intervention trying to reduce the risk identified. So part of risk presently is identifying the historic risk based on someone's past actions. So if someone's committed these crimes, thus they're likely to continue to do that. Plus their current, as in the last 6 months or so usually, clinical risk. That means how many clinical challenges do they have to staying on a path that they would otherwise want to stay on. So if someone says, I really don't want to steal cars, I'd much rather have a normal job, they could really mean it, but then in a time of distress, due to other clinical symptoms that they're experiencing, may panic and steal a car anyway. So part of what we do now is reduce that risk by providing clinical interventions to reduce the chances of someone acting, for example, impulsively or acting in anger or something like that. This used to really never happen, and it's been something that's increased momentum and gotten a lot of traction in the last 10 or 15 years. And now, as I was saying earlier, we have these mental health treatment requirements. They've been around about 10 or 15 years, but were never ever used. And about 6 years ago, we started performing research to suggest how important they were. And now about half of England has them as a viable option. Training and educating, so really just training people in specific risk assessments or joining a university, performing research. This is very much like research anywhere else. So someone could be performing this as part of a PhD or having been driven by a PhD. I myself come from that type of background. Policy change and management. I do everything I can to contribute to policy change, and you'd be surprised what type of cabinet ministers get a hold of some of these reports and send in an email. Right. Who employs forensic psychologists? This obviously is not an absolute exhaustive list, but these are the top employers. If you are going for a career in forensic psychology, these are probably the organizations you work for. St. Andrews, I mentioned just because it is a very large mental health charity and it does have more than one hospital, but it's here as an example of the third sector, just generally third sector stuff. There are many charities out there that would employ you. The NHS is the top employer. It isn't HMPPS anymore. I mean, it certainly should be in some senses because it is forensic psychology, but the NHS, through either direct employment or through contracts with other organizations, focuses on the health of people, whether they're in the criminal justice system or not. And as a result, you do tend to see an increase in employing psychologists and forensic psychologists included. The HMPPS, if someone is very, very keen to work in a prison, you will definitely get a job. That's what I'll say about it. I mean, we're going to be another slide where I can talk about exactly what it's like to work there. The parole board, very interesting work. The Metropolitan Police, again, I've done some work for them. There's another slide, I'm going to come back and give some details. MI5, they do hire forensic psychologists specifically, and they had a recruitment drive not too long ago, recruiting forensic psychologists specifically. I have never worked for MI5 because I was not born here. You have to be born in the UK to work for MI5. So what's it like working for the NHS? You'll probably work in a forensic hospital setting. You'll have people detained under the Mental Health Act. They're a risk to themselves and others. You'll probably be providing CBT, DBT, and EMDR. That's cognitive behavioral therapy, dialectical behavior therapy. EMDR is eye movement desensitization and reprocessing. It's for trauma, prolonged exposure, also for trauma, etc. These things are going to mainly center around trauma, and you tend to find that the further you go in your career in forensic psychology, the more of your time is spent dealing with trauma. Community outreach, that usually means with local authorities and NHS partnerships. This could be providing FFT, MST, and just general clinical support to MDTs. I'm sorry about all the acronyms here, but this is important for you to know these, so do make notes about them. Somebody might mention these in interviews, even for volunteer positions. So FFT is functional family therapy, MST is multi-systemic family therapy, and clinical support to MDTs. MDTs is multidisciplinary teams. So these are things that you're very likely to see as acronyms working in psychology alongside NHS partners that are local authorities. So I launched a service in Coventry in 2012 doing MST. I worked with the Cambridgeshire service, again with MST, and we drew in other psychologists from FFT backgrounds. I worked in FFT and supervised some of that practice there too. And we work with MDTs every week. And so if you don't know what these are and you go for one of these jobs, you're unlikely to be successful. But this is, I would say, a good intro into working in forensics. So if you're working toward the doctorate, these types of jobs doing things like MST are ideal because you learn a lot about the early development of antisocial behavior, criminal behavior. And while there are a lot of crises to deal with, and you may even be on call, you will learn a huge amount doing this, more than I think any other way in. And this is all part of my personal theory that forensic psychologists should start in dealing with adolescents. It's my opinion. And MST is a great way to get involved in that. By the time you're working in a forensic hospital setting, you're probably dealing with adults, although obviously forensic CAMS is a thing. CAMS is another acronym, that's CAMHS, that's Child and Adolescent Mental Health Services. And so you will have forensic CAMS as something that someone would be very interested in hiring a forensic psychologist for. But the majority of what you'll be dealing with is severe and enduring mental health problems and people having been brought in because someone called the police and the police called an ambulance to deal with mental health issues. What's it like working for the prison and probation service? The prison setting, you'll probably be doing a huge number of risk assessments. That's probably be all you do. The people that I've interviewed who come from mainly working in prisons know almost nothing about actually treating people. It's not necessarily pervasive. Obviously, you'll have tons of people working in prisons who have a desire to help people and provide psychological treatment, but the prison service currently doesn't support enough of pathways for people to access treatment myself. There are things that they call pipes in the prison service, and these are specific pathways for mental health services, but there are only a few in the whole country. So while there are people who are definitely expert in providing treatment within the criminal justice system in prisons, they are very few compared to the huge prison system. And as a result, working in a prison setting, you're unlikely to get clinical experience with interventions. You're very likely to become an absolute expert in providing risk assessments, especially things like the HCR20, the RSVP, and stuff like that, PCLRs. Those HCR20 is a very commonly used forensic risk assessment, mostly for violent behavior. The RSVP is for sexual violence, and the PCLR is for psychopathology. So you may lead groups like TSP. The TSP is called a thinking skills program. It doesn't actually need a psychologist to run it. If you work earlier on in your career in a prison for a brief period of time, that could be a good segue into a doctorate or something like that, because you might do some group work with prisoners. Most prisons have TSP, and you could be in a situation where you're helping co-facilitate a group. It's manualized, and so it's a good introduction, but I wouldn't do it forever because you'll get bored. Occasionally you'll do one-to-one work, but it's very, very rare. And usually another psychologist will have come in, read someone's risk assessment for parole, said, I'm not recommending parole, but what I'm recommending instead is 6 more months, then return to the parole board. And in those 6 months, somebody from the prison gives some one-to-one work with them once a week. But sometimes the prison doesn't have the resource to follow up on that. So the probation setting stuff, I've got the slide saying it's currently outsourced, yes and no. So it's not necessarily done within HMPPS. So if you're providing clinical work within HMPPS and it's in probation, you're probably working for a third sector, like a charity, like working for St. Andrews. So it's not necessarily that you'd be working for HMPPS. The funding would come from there, and you might have a project manager from the National Probation Service or something. Currently, this is done in these short to medium term therapies, usually about 3 to 4 months long. Someone will be sentenced to a community order in lieu of going to prison, usually for a relatively minor offense, so low to medium forensic risk already. And it's to avoid this kind of revolving door problem of people getting short stays in prison, not having any benefit to that, the whole experience being a general disruption to their life, and then coming out even less prepared for life than they went in, and then likely offending again. And they want to break that cycle by providing some sort of community-based sentence wherever possible, under the idea that if you provide mental health support, you reduce some of that dynamic clinical risk in the community and maybe help someone stay out of prison. So we're providing these services now across the Southeast, but they're also available in, as I said earlier, about half of England's judiciaries. Working for St. Andrews, or generally third sector things like that, you're usually working in an NHS contract. You're typically working with personality disorder. It just tends to be mostly what we do in the inpatient settings. A huge amount of personality disorder work, usually using DBT. Community programs, things like probation. We work with veterans, so we have a contract with the Ministry of Defense to provide services for veterans who have experienced trauma. We work with children's homes, and we try to transition people from secure settings back into the community and things like that. This is very, very broad, and I'm happy to answer lots of detailed questions about it later on, but essentially in this sector, you're looking for government contracts. And when you get to a senior level in psychology, you spend a lot of time looking at opportunities that the government puts out there. You create a service in the moment for what they want, describe it to them, and they decide whether or not to fund it. And in the past 5 years, myself and my immediate team have brought in about £4 million of funding to this charity doing this. Obviously, it's usually put to work, to provide services. It's not like sitting in the charity's bank account. It's money for services. And this is the only way charities operate in this setting. So this is how it works. I'm happy to discuss that as well. Working for the police. Usually, there are two things that you would want to do with the police going into forensic psychology. It could be that you go into forensic psychology to progress faster in the standard police career path. So I knew a person who became chief constable of Gloucestershire because they got a doctoral degree in forensic psychology. It's not that it guaranteed it, obviously, because that's the top post. But what it did was they found that they would accelerate through. They had to start at the same level as everybody else, walking the streets in the night with all of the other constables, but they just progressed fast. And I think that it's not just a forensic psychology degree that would do this. I think a PhD often does the same. Just anything that gets you thinking critically about large amounts of information, it develops your thinking, and it develops your thinking about people. But a forensic psychology degree is great for this because it gives you a totally different perspective from everybody else in the police force, in my opinion, about criminal behavior. So this specific person advanced all the way to the top faster than most people would be expected to. But even if you don't go all the way to chief constable, you could end up progressing further than many of your contemporaries by getting an advanced degree. So there are also a lot of brief contracts and consultancy opportunities. So providing trauma work, again, I mean, psychologists provide lots and lots of trauma work, but obviously in the police, you experience a lot of trauma. And unlike television, where it wants us to believe no police officer would ever want to talk to a psychologist about their experiences in the police, we actually see the demand being quite high. People do want support. And I think this is a part of a changing general culture in society, not just in the police. But people do want support because statistically, we do see that if you don't deal with the trauma, you take more time off work, it harms your career, harms your family, it ruins your relationships, etc. So people do want the help, and it tends to be taken up. Working for the parole board, you tend to do highly detailed versions of the assessments I've mentioned before, usually like 8,000 to 12,000 words, when a report could be done in 1,000. We're doing these lengthy, detailed ones that go back over the whole life of a person and coming up with an opinion as to how risky someone is, should they be released into the community, etc. I've never seen a parole board recommendation I've made not be acted on. So the psychologist, when they choose to have one, is extremely important in determining the parole chances of a person. And I can tell you that this is one of the most interesting experiences that you can do. You can make this full-time. I mean, there's not really progression in it because this is something that you would be doing almost, as a self-employed person. You don't get employed like as a salaried member of the parole board to do this. You bid for the opportunity to do these assessments. And then you meet someone, and them meeting you is the culmination of, at times, several decades of waiting. So they know that eventually they're going to have a chance for parole. It tends to be if they bring in a psychologist, it's for the more serious crimes. So I've only ever had, child sex abuse, rape cases, and murder cases. I've never had anything less serious than that in doing these, because obviously psychologist time is expensive, and you have someone who's been in prison for a long time. The shortest length of time I had was 17 years. Somebody was in prison, and they could be over tariff. They could have been sentenced to 7 or 8 years, but been kept in prison due to public protection needs. They couldn't get someone to do the assessment. People have been waiting years sometimes after having been told you need to have a psychologist assessment, just because there are so few psychologists in the country. So they're waiting, anticipation builds, and finally you turn up. And so when I'm there, they are usually very eager for the assessment. They want it to go really, really well. And you're sitting with this person you haven't met before, but you will have read this several 100-page dossier about them and their crimes. I had someone who was in their 80s and had committed sex offenses in every decade since the 50s. And he had never spoken to a psychologist before, didn't really know what their job was. And him having to answer some of these questions that are posed, sometimes he'd never thought about these issues before ever in his life. He'd never thought about the different reasons why he might be doing what he's doing. And I can genuinely say that that moment when the two of us enter the room and we know what we're about to do is one of the most intense experiences I've ever had. I mean, it's really profound, because you're not going to get that in any other setting. You're not going to have someone waiting decades to see you. And at the end, people usually will have learned something and are surprised about that. So unless they've had a very specific similar assessment in the past, which is unlikely, it tends to be they've never been asked these types of psychological questions about it before and had to go through the crime in this way before. After all that, you appear at the parole hearing, and usually when you've been with them, you've been trying to develop a rapport, you're engaging with them in some way that you'll get them to speak to you openly about their experiences and their feelings, etc. And usually they think, okay, this means it's going really well, and maybe it is, maybe it isn't. By the time you see them in the parole hearing, they may not know what you're going to be saying in there. And then when you answer your questions, sometimes you're surprised. It's an interesting situation. So I've never worked for MI5, but I do know people who have. So the behavior scientist role, you do behavior profiles. It's not typically related to serial murder, I'm very sorry. Usually involves counterterrorism and anti-radicalization strategies. So it's mostly to do with radicalization, I would say that. So you're trying to reverse the effects of radicalization, identify who's at the top of pyramids of radicalization schemes locally, and just generally helping MI5 with that. It helps to speak the language, and I don't mean like the theoretical language of psychology, I mean the language of the variety of cultures. So it tends to be that they recruit into specific community targets, and so they want someone to speak the language. So, how to become a forensic psychologist? Need a solid undergraduate degree, and your performance in your undergraduate degree is almost more important than your performance at any other stage of the process. You need some volunteer experience, and the setting is much more important than what you're doing in it. So you could be bringing coffee to people, but if you're bringing coffee to people in a secure mental health hospital, that's great. And I don't mean that in any sort of sarcastic thing, just being in there. It's proof you can cope in that space. So the setting is more important than anything else. It tends to be that people really will do practical tasks in there, like move stuff around. It's easy, I mean it's easier to get relevant jobs and things that are like a befriender, or just someone who just has conversations in these types of spaces. It could be community, it could be secure settings, but oftentimes I need people to literally just be a person in the room who has been given some induction to show about safety, interpersonal, relational security, and to raise issues if they see issues, just bring people's attention to things, and to just occupy the people in there, have conversations with them, generally write down notes. It's not necessarily a psychologically minded task, but proving that you're able to work effectively in that space is very important. Get a master's degree. Your performance in your master's degree is pretty irrelevant. Just finish the thing. Once you have a master's degree, you can have a psychology career. You don't have to go further than that, but it will cap your earnings. So if your vocation is to work directly with people in a setting, we're hiring pretty much all the time people with master's degrees. They do most of the clinical work that we do, but you're not going to progress with the master's degree only. You've got to really go for the doctorate in order to progress these days, unless we're talking about someone with a lot of experience doing other things like management experience. So once you get that master's degree, get a job as an assistant psychologist or relevant, like MST therapist, FFT therapist. Those are all jobs that you can do with a master's degree. And some people decide, okay, I want to be an MST therapist for my whole career or an FFT therapist for the whole time. And people do it. There's absolutely nothing wrong with that. It's just if you don't want the type of career where you progress and manage other psychologists or increase your earnings or something like that, if that's not important to you, then these are the types of jobs where you're doing the most clinical work. An example is a newly qualified doctoral level forensic psychologist in our services would have maybe 6 or 7 hours of clinical time a week, whereas the assistant psychologists, they all have master's degrees, they would have more like 18 to 20 clinical hours a week. So if you really want to do the clinical work, that's a job you can stay at forever. And I'll get to what the earnings are in another slide, so you can think, is this practical to stay at that? It's totally up to you. If you want to go into the doctorate, though, participate in a research program. I give opportunities for assistant psychologists in my teams to participate in research. They can contribute it in whatever way makes sense, and then their name goes on the paper. And once you have a name on a published research paper, and you understand what that research has been about, they're in a really great position to represent that in an interview for a doctoral place. You do need to understand both the clinical and research aspects to go into a forensic psychology doctorate, even though the research is a relatively small amount of that degree. Apply for a forensic psychology program every year. It does tend to take people a few years because you're competing with people who've already been working in this field for a little while, have got some experience doing some research, etc. I've never seen anyone, even very, very capable people, never seen anyone do it like the first year right after doing their master's. It tends to be that they work as like an assistant psychologist for 2 or 3 years before they progress with their doctorate. That's normal. But there's no wasted time. You'll learn something every single time. Choosing a program, find a doctoral program that has a strong placement scheme. Placements means where you're going to work. So a forensic psychology doctorate is basically like supervised practice. They supervise what you're doing. They make sure that you're getting experience in enough different settings and with enough different types of presentation to qualify you at the end of it. And you're keeping a placement log where you talk about what you've learned from that placement, and you discuss it with 2 supervisors, your placement one, which will usually be somebody in my type of position, and then your research one, or your one from your university, also talks to you about whether or not your practice is meeting the requirements of their end of the accredited doctoral program. Tends to take 2 years, that's 4 placements, so 6 months per placement. You can finish it in 2 years if you can line up your placements effectively. And a university scheme with a good history of being able to line up those placements and help you do it is great. Ultimately, a lot of it is up to the person in the program to find the placement that they want. They have to make a lot of contacts and push for them and interview, and it's sometimes difficult. But I've never seen anyone take forever to finish their forensic doctoral program. Placements are usually very happy to have people who are working as trainees toward their doctorate because they're exceptional candidates. They would have had to pass the doctoral interview to get into the doctorate. That usually means you're very employable. So by then, we, in St. Andrews, bring in trainees all the time, even though they're only going to be with us 6 months. We try to get them a second placement with us right away and line it up because we want to keep them. I've recently supervised someone who finished their doctorate who was with us for all 4 of their placements and never had to leave us. And that's something that's really valuable to us because we get to retain all that expertise. Doctoral training is all about these placements. I mean, there's a research component, but it's tiny compared to doing a PhD. So the placement element is really what you're looking to do within your program. Try to get placements that pay you. Not all of them do. And when someone isn't hiring, like we've been in a position in the past where we weren't hiring, so we didn't have anything in the budget to pay people, we were still getting trainees coming saying, I'll work for nothing. So sometimes people do that. And I encourage you, of course, to finish your doctorate as fast as you can because your earnings increase when you've concluded it. And sometimes that works out mathematically for you. If you've got a living situation where you don't need a lot of income while you're doing your doctorate, then by all means, get whatever placement you can. But it's nice to get paid. I mean, people get paid a reasonable salary when they're trainees with us. So it's something that I wouldn't let slide. I mean, do try your best to get a placement that pays you. It's not like in clinical psychology where you get onto the program and they give you a stipend throughout the entire process, because they essentially manage that element for you. So they place you in certain positions and that place pays the university back. It's not like that in forensics. So it's entirely possible, if this isn't managed appropriately, to end up in a placement where you don't earn anything. But a good placement organization will help you find placements that'll pay you. And if you want that to be a priority, it's absolutely workable. Incidentally, just because you get a placement position doesn't mean you have to leave your post when the placement finishes. So starting with us in St. Andrews, if someone were to be employed as a trainee and stay with us for their 6-month placement, that's their post until they leave it. So until they get their next one, they can stay in the post that pays them. So you're not kicked out necessarily at the end, unless you've signed up for a 6-month fixed term, which I've never seen, ever. So tuition fees vary, but they're around $8,000 per year. Some people get loans for it, but that is what it is.
James, could I jump in with 2 questions? One question was about money, as you have the money slide here.
I've got the money slide.
Yes. I think the other question was about if I want to work for the MI6, I can't because I'm not British. But if somebody's interested in working for the MI6, what would be kind of a route? Would you have to be first forensic psychologist and then become kind of like, work for the MI6, MI5? Sorry, I'm not good with that.
It's MI5. So if you want to work for MI5, you have to already be qualified as a forensic psychologist. You probably have to have a few years experience behind you doing it as well. And then you have to be exceptional on top of that, because there's a lot of competition for those jobs because people think they're really cool. I don't know if they're actually good jobs to have or not, but because people love to say stuff like, oh, I work for MI5.
Counterterrorism. It sounds pretty cool to me, I have to admit.
It does. It sounds really cool. I would have applied for one myself. I rang them up because I saw in the adverts, like, must have been born in Britain. It's like, look, I'm a citizen. I've got strong ties. I've been living here my whole adult life. Can I not do? I'm totally qualified for that role by then. I'd been a qualified forensic psychologist for like 6-7 years, and I had lots of relevant experience. So I could have done a lot of the stuff they wanted, but they said absolutely not. There's no point in applying.
Okay. So I hope that answered the question. So you basically first have to become a forensic psychologist. And then I think Libby has a question. We can maybe ask this, or I don't know. Let me first ask one more question about the slide beforehand. If I finish my master, I probably, let's say, I don't have much money. My parents are not very wealthy. I have to pay for the masters, right? There's some kind of stipend, but then for the doctorate, is there anything sponsored? Is there anything that I can kind of get support, or do you know, how does that work? I mean, it sounds very much like counseling, where you pay and it's all about selecting a program with strong placement teams that help you find good placements, and then you get paid ideally, so you kind of, I think you can pay the money it costs. But is that, I don't know if you want to say something about just how do you,
the reality of it is that when you're doing your doctoral training, you're a trainee. So the row on here, I said trainee with a star on it. You're earning sometimes, and it's not every time that it does this, because sometimes people give you additional salary based on the fact that you've gotten into a doctorate, you're a trainee, you're a better candidate. So you can sometimes get more money in your basic salary during your placement on the basis of you being a trainee, because it does show additional qualification. Just getting on the doctorate is an achievement. So we do pay people more when they've gotten into a doctorate. But it's important to note that the amount that's different there is still less than the cost of tuition. So when you're a trainee, your actual end of the month remaining funds are probably lower than they will have been, for most of the time.
Okay,
so it's a struggle during that time. But it's only 2 years. If you manage your time as a doctoral trainee correctly, you pay that tuition for 2 years, and then you should be finished. Even if you haven't finished, you should not be paying more. You probably have to pay a write-up fee. Most universities have a write-up fee for your research if you haven't submitted it yet or something. You have some delay, which is very, very low. So it could be just like a few £100 or something for the year for the write-up fee if you haven't completed your research, but you have completed your placement. But for the most part, yeah, you got to struggle through those 2 years. But then when you break through that, notice the difference in salary afterward.
Okay. Yes. Maybe I think there's a lot of question. I think this was okay. So I mean, in some ways, I think it's like if you want to do it, it's doable, and you will not starve. Right? That's kind of like if you're a trainee, you get money, you earn money if you have a good placement, and you will earn less maybe as a system psychologist because you have to pay the tuition yearly. But it's not, you're not going hungry to bed, right? Is that the correct way to put it?
That's right. I mean, if you look at if you compare the amount of money you take home at the end of the month as a doctoral trainee, even after tuition, it's probably about the same as what you had as a new graduate, like right after you finished undergraduate school. If you were to get a job right after that, you'd probably earn about 23. So it's basically a kind of 2-year setback. Don't expect to go on any holidays during those 2 years anyway. You won't have time to spend your money, so you'll probably come out okay. You're gonna be so busy during those 2 years. Okay. It's just a hard 2-year period because you've got to do your research and you've got to do your practice, keep your practice diary, etc. You have usually the same level of responsibility as an assistant psychologist, but you have all these other things you need to do for your degree. It's just, you got to buckle down for 2 years. That's just the way it is.
Okay. So that's, I think there are a bunch of questions about work experience. I'm not sure. So if I am a volunteer, I'm not sure if we should.
Well, shall we wait? I don't know. I can't remember how many slides I've got left after this. I mean, this is the money slide.
I can postpone that and come back after you finished.
I'll come back to the money slide as well if people need it. And of course, you're welcome to distribute these slides with the recording as well.
Okay, thank you so much. So maybe if that's cool with everyone else, I would say let's talk about where to find relevant work experience after the talk. I think yes, okay, one thumbs up, and then we can kind of okay, that sounds good. I think it seems like everyone is on board with that, and then we could just let James finish his talk, and then we can talk about work experience. Is that good, James?
Yeah. So the what's the money like thing, I've been on it for a little while. People have been probably studying it, and we've been answering some questions already about the money before you qualify, which is obviously a very important part of people's lives. It's also worth noting that in this pre-qualification period, there's a tremendous amount of competition for roles. So an assistant psychologist, when we put up a new posting, we usually get between 100 and 250 applicants. Of those, maybe 80 to 85 of them will have the relevant master's degree. So those are the only ones we realistically consider. And then based on their past experience and the quality of their application, we reduce that down into very quickly, like it is just by skimming them, we reduce them down to like 25, 30. And then we have a very careful look at the top 30 and reduce it down to maybe like 12 people, and then interview 12 and hire 1. So it's very, very competitive for an assistant psychologist post in the Greater London area. Obviously, it's very, different, I would say, in other parts of the UK where the competition is lower. You will have a different landscape elsewhere. And it's not uncommon for people who are living in London to leave London to get some experience and then return. I see that constantly, of course. But if you can get one of these posts, fantastic. It tends to be people have a year or so of experience before we hire them as assistant psychologists in London, just because of the competition. It's not required. It's just people have it, so why wouldn't we hire them? When you're qualified, though, things change dramatically. In central London, offering 54, that's not including the London waiting, which was, you know, another, see, what was it? Another 3,500 on top of that. And then we gave a bonus of another 3,300. So somebody was earning potentially like 61, 62,000, even as a newly qualified person, potentially. We really pushed up, and we only got 10 applications. The reason is there are just not that many qualified psychologists in the UK. And a lot of the people who are qualified psychologists, they may choose to work in private practice or something. Not a lot of people want to work in the sort of things that we do. You know, we deal with a lot of intense things, a lot of serious issues. I mean, people, by the time they qualify, they start to want more of a relaxed lifestyle because just they've moved on in life. And it tends to be that by the time people are newly qualified and then they get a couple of years experience, they've settled down in their lives somewhere. They don't want to, you know, relocate. They don't want to change their job to something that may be more stressful. But yeah, you go from a thing where there's a lot of competition for these roles, huge competition to get into the doctorates. You know, it's very, very challenging to get into a doctorate and become a trainee and then get salaried posts and everything. And then you qualify, and it's like you're made of gold. Everybody wants to hire you. There are tons of jobs and nobody's applying for them. So you can basically pick and choose where you want to work. It's a really different lifestyle once you get that doctorate. So it's not necessarily required, but it does change a lot. If someone chooses to stay at an assistant psychologist type of level and get lots of experience, you can, in that role, push the salary up and up. So if you're working in that, you know, there is some wiggle room. You can move up to like a 30 or 31 base salary and then get inner London waiting and even a bonus on top of that. So we've had people in assistant psychologist posts usually, you know, potentially getting 36, 37,000 and staying there and having that be their career. And they can move around to other jobs sometimes because it's rare to see someone looking for those roles who have like 5, 6, 10 years of experience. If you see someone like that, you're going to hire them, definitely, even with, you know, 200 other applicants, because it tends to be people applying for those jobs are very early career. When you're qualified, you can move up. So the difference between newly qualified and the supervisor one is usually only 3 or 4 years post-qualification experience. A principal, the requirement is 5 years, so it tends to be you can't get a principal post. That's usually an NHS Band 8B post, and tends to be you can't apply at all unless you have 5 years post-qualification experience. And the consultant level is usually, you know, some amount more than that. So when I got my consultant job when I had 9 years, I think, post-qualification experience. Yeah, I think it was 9. So, and that's where it is. You really don't go any further beyond that unless you decide to become like a hospital administrator or something, like go into management, do something else, which I'm not going to do. So now we can do questions. There wasn't a whole lot of more slides after that. And I might actually choose to stop sharing because I can't see anything except this.
Yes, that would be great. All right, I think we could do it like this. I think there was a question. So the first question that was asked.
Did it stop sharing? Sorry, Andreas. Can I just confirm it stopped sharing?
Yeah.
Good.
I think I can't see your screen anymore. I can only see
you. Can you see me?
Yes. Very well.
Great.
So I think the biggest question was around getting work experience. So I think you addressed it a little bit. You said you need to get experience in the setting, right? So meaning you have to show if there's, I think you said it, I can't say it better, which is good. Could you elaborate if I'm kind of like a student? I think Libby asked about placements. Is that something like year-long placements? I'm not sure if you're familiar with that because I think you didn't go to in the UK to University, is that true? I think you came over after university, right? From
Well,
the US?
I'm familiar anyway. I mean, my trajectory into the career myself is a bit unusual, so I wouldn't model your career on mine. But I supervise the doctoral process. So even from very early on, I help people go through the whole process. So I hire people early in their career and help them through. I've done this now 6 or 7 times. So I'm very familiar now with the way the placements work, and I supervise the placement. So you tend to have 2 supervisors, the university one and the placement one, and I'm almost always the placement one for people who run our services. A placement is 6 months long. Any placement is 6 months long. And so you'll have 4 of those to complete your doctorate. They don't have to happen in any particular, order or something. They can be mixed and matched.
Yeah, but there's this other thing that we offer basically, or you can have a sandwich here between your 2nd and your 3rd year, whereas the university student, you go out, most of our students, if they do that, they do placements within the NHS and kind of.
Oh, I see what you mean. I see. I had one of those
psychology's roles.
I had one of those in America. Mine was with the Alzheimer's Association. So, but when I started, I think in the UK, I didn't see a lot of people doing that. But it's a very valuable thing to have. I mean, really anything that you can show that you did is important. I would never hire anyone. I would say use that term with some caution to say never hire anybody. But I would be very unlikely to hire somebody who hadn't had some experience in a relevant setting. Even if it's just like a few months long, they would need to be able to describe how they coped with it. I would want to know how they experienced that time, and what they actually did and the skills they learned would be less important to how they felt while they were there. And if they could pull out a couple of key things about what the place was intended to do and what you observed and stuff like that, and make it sound super smart, that helps. But for the most part, someone's experience in a place is much more about us being able to tell that someone will be resilient. So when you're looking for a placement, you can think outside the box. I wouldn't want to reduce somebody's aspirations to a few suggestions, because that would be wrong. There are lots of different ways you can get that experience. It's all about making sure that it's a setting in which you're able to demonstrate your own personal resilience. It has to be a challenge. Most people, would be finding what that is uncomfortable. So working in a secure mental health hospital, most people walking in a ward, particularly with forensic patients in it, would be nervous, and you learn to cope.
Yeah.
And it's that learning to cope in the space that's important. And that could be anything. It doesn't have to be that specific thing. It could be a children's home for looked after children who have severe emotional behavior problems. It could be really anything, so long as you can imagine somebody would be uncomfortable there and you learn to cope somehow and you know how you did it.
All right, so I think we have some really good questions. So I think, there's one question about what's the difference between forensic psychology and forensic psychiatry. The classic, I know what the difference between psychology and psychiatry is. One is like a medical degree and one isn't. Is there, if you want to become a psychiatrist, you have to study medicine and then specialize in psychiatry. Is there anything more profound you can add to that?
Well, I wouldn't call it profound, but forensic psychiatry, I can say that they tend to, obviously the forensic element means they're focusing on criminal behavior again, but they're explaining that risk medically. So they're saying this person is more likely to act out violently because he has an acquired brain injury, and here's how that works. This person was born with a particular type of learning challenge, which means they struggle to understand emotions in this way, which means et cetera, et cetera. You go down this more medical explanation for the behaviors being different. I can tell you that the earnings are a lot different. So if psychiatrists earn more than psychologists, that's just the way the world works. So if you want to go down a medical path, then you will earn more money. I can tell you that the psychiatrists that I know don't understand psychology. A lot of people have this misconception that psychiatrists are like the more advanced version, like they understand psychology as well, and then they can also prescribe and understand the brain and things like that, but they don't. They know very, very little about psychology. They don't understand emotions particularly better than the general population. They're just medical doctors that specialized in psychiatry, which means they specialize in the brain functions and the medicated solutions to problems that happen to be having to do with mental health. But they don't even particularly do things like read nonverbal communication or engage people any better than the general population. I mean, there's not a difference there between a psychiatrist and other medical doctors necessarily. I can't speak for all of them because there are some talented people out there and some people who've also studied psychology on top of it or what have you, but it's not their job to do that. So they mainly prescribe. They usually spend 15 or 20 minutes with patients and prescribe. And we in the hospitals rely on them for prescriptions, but we don't consult them for anything else. It tends to be psychologists make all of the type of risk decisions, and psychiatrists prescribe.
Okay, James. Yes, right. I mean, I have a relatively low. I think I'm. Yes. Yeah. Let's leave it with that. So I think it was really good, and I think it very much sums up my feelings to that topic as well. I think there's a personal question, like a slightly personal question, and a more professional question. Which one do you want to start first?
Well, let's get personal.
Okay, so one question is about, did you ever stop kind of with your never-ending stream of education? Did you take a little bit time off in between? I think in one of the previous talks, you talked a little bit about your career, your early career. So I know a little bit about this, but I think the question is basically, what I think with my little amount of empathy that I have is like, oh, you're doing your A-level, so then you go to university, then you do a master, then you're a little bit in, but you're trying to get into a doctorate, so you never really leave the education system. I think, between master and doctor, profound. But for you, did you ever felt like, oh, I can't see any learning anymore?
So I do. Again, I'm going to answer the question, so there's no problem answering it. I'm going to preface it with don't follow my example, because I'm not only is it really unusual generally in the UK, but also I'm a little older, so it doesn't necessarily apply in the same way. But when I finished undergraduate school, I was able to get a job working in multisystemic therapy as a therapist right away, right after undergraduate school, which is unusual. So today, particularly in London, it would be very hard to do something similar. Although elsewhere in the UK, you can, and I have seen people without the master's degree get a job providing similar therapies in the past, because it's a highly supervised style of therapy. You have a lot of hand-holding from your qualified psychologist. So I was doing that in America. So I got my undergraduate school there in Georgia, and I started working in Tennessee, providing multisystemic therapy, supervised work. And then I skipped the master's and did a PhD instead. It was going to be a master's and a PhD in a 1+3 type format. But after my first year, I was able to skip the master's and do the confirmation of candidature for a PhD and finish the PhD in the 3 years instead of the 1+3. That wouldn't have qualified me to work in forensic psychology by itself. But what I did is I applied through what's called the international route. So everything I was presented in this lecture today is about the UK approved course route. If you're applying through an international route, it's a lot more flexible about what you can describe as your experiences and what you can include. So because I had a PhD, it's a research degree, I had more than enough to satisfy the research requirements for registration as a forensic psychologist. So I just needed to demonstrate that I had adequate experience in all of the domains necessary to qualify. And this is still the case, that you can qualify as a forensic psychologist without getting a doctorate in it, so long as you've worked in the settings and you can prove it. This was a really long process for me. It took about 18 months. I had to get a lot of documentation from my previous employers in the United States, my placement with the Alzheimer's Association, my MST experience, a job that I'd gotten in the UK after finishing my PhD, which is also MST related up in Coventry. And I put together all of this information and submitted to the HCPC and was able to get my forensic qualification that way. So it was a lengthy and convoluted process. It took so long to get all the documentation that I could have done another degree in that time, to be fair. So it's not something that you would really recommend anybody try. Anyway, after my undergraduate degree, I worked for about 2 years. It was more like 18 months, I think, in Tennessee doing MST. And at the time, I hadn't intended to continue my education. I didn't have a master plan. I had just finished undergraduate school and I was like, I just need some money. I want a job, please. I just, my girlfriend and I had broken up, so I didn't have a place to live. So I needed work. It's like one of those things in this life, So I just found a job. I was like, I'm just going to, survive out here. I got a place to live, and I did MST for a while, but I was only intending to feed myself and have a place to stay. But after I kind of secured myself there, I've been working at it for a while. I was saying, this is interesting work. I started to appreciate it more after I really got into the deeper aspects of the work, rather than just thinking of it as I need a job and I happen to have gotten an undergraduate degree in psychology. It was a job I could get. I didn't even choose it necessarily. It was available and they needed somebody, and I went for it and I got it. So I wasn't trying hard to move into the forensic psychology career path, but I discovered an appreciation for it while doing a very challenging forensic psychology type job, working with within the juvenile, they call it the juvenile crime system in America. So you have juvenile detention centers, which are prisons for kids, basically. It's just a weird way of life in America. But I was working alongside them, trying to keep kids out of juvenile detention using MST, and I developed an appreciation for it. And I decided to progress my career in a different way from then. So I don't want to convey the sense that you necessarily have to plan every moment of your life in order to succeed in doing this, because of course you can take some time and do something else and come back or whatever. It does help for you to develop the skill of being able to take experience from what you're doing and apply it to the forensic psychology pathway. So if you have some notion that you might want to do this, but you're not sure if you want to do forensic clinical or counseling or something, pick some type of placement that gives you experience that could be applied to any of them. It's not as hard as it sounds, because being able to apply the experience of a clinical setting to all three of those different disciplines is relatively straightforward. It's just in how you word it. So just think about it, and you should, because my placement, the Alzheimer's Association, has nothing to do with forensic psychology, but everybody thought that was super important. When you phrased it in a way, it's like, okay, you're helping develop the coping strategies needed for carers to deal with the impossible to accept. And that is something that's prevalent throughout forensic psychology. How do family members and victims deal with things that are impossible to accept, but nonetheless true? And that's an important element of forensic psychology. So you can apply something from Alzheimer's work to forensic psychology. You can do that as well with any of your placements.
All right. I think I'm a little bit conscious of time. I have kind of 2 quick questions. And then I think one, okay, so maybe could you say a word about picking the right masters? I think in the chat I can see there's a little bit is it better to choose something that's only forensic or forensic with mental health? I mean, they all sometimes have some kind of, so yeah, what do I have to look out for if I choose a master's for my, a forensic master, yeah.
I think the master's is, in my opinion, the least important step. You got to do it, but it's more about how you represent yourself afterwards. Nobody's going to be looking into your master's thesis or the research you did while you were doing it necessarily and think, I'm going to compare this person's master's to this other person's master's, and this person is definitely hired because they've got a better master's. It's never happened, ever. It's all about how you present yourself after it. My advice is when you're doing your master's, practice talking about psychology. Don't just learn the content. Talk to people about it. Talk to yourself about it in the mirror, whatever you got to do. Discuss psychology.
Yes. So is this BPS accredited, or what do I have to look?
I mean, yeah, do a BPS accredited course. I mean, I think that there's a minimum, but to be fair, I'm actually going to retract that statement. It doesn't even have to be a BPS accredited course if you do it somewhere in the world. It has to be one if you do it in the UK. Okay. But I've hired people who've done their masters, in lots of different countries.
Oh, that's awesome.
So if you do a master's in Italy, I mean, I've got someone on my staff right now who did their master's in Italy. So, they happen to be Italian. I don't know if that matters. If you want to go to Italy and do your master's, have fun.
Yes, I like that. Okay, but it basically, if you're in the UK, choose one that is BPS accredited, but it doesn't really matter that much. It's more kind of that I think, start thinking and applying psychology, forensic psychology to your
Be able to discuss psychology in a way that shows that you understand it, but you're not just reading from the book. You get to internalize the information, be casually smart about it, and do a lot of clinical role plays. Practice with your friends, clinical scenarios. One person's the patient, one person's the clinician, swap. Do it as much as you can with as many different people as possible. Get feedback from people as much as you can about that process. You will have to do a clinical role play in an interview. If you were interviewing for me, we would have a 5-minute long clinical role play, and in 5 minutes, I would make so many judgments about you, about how you were presenting yourself clinically, how someone would feel working with you, and everything. So you got to be able to do that well.
So Jody asked, kind of like, I think, if you do your masters in the UK, do BPS, right? But if you don't, do it in the UK. I mean, there is no British Psychology Society outside the UK, so then you don't have to worry about that. Is that correct?
Yeah, but look, I haven't gone through all of the different things that are psychology or forensic psychology related in the UK and looked at accredited versus non-accredited, et cetera. When I'm glancing at this part of someone's CV, I'm like, does this look normal to me? If I think someone is just gone to something that may not sound particularly legitimate or might not be an actual master's, that would be really weird. That would stand out. I don't think I ever remember that happening. I mean, all the applications I get, people went to like a university I've heard of. And that's, it's like, okay, they've got a master's in either forensic psychology or criminology potentially. It's not quite as good, but it'd be absolutely fine if they did that instead. Or some people did mental health. That's fine. Clinical will work. You don't even have to be specific at that stage. You can do a clinical route the whole way and change to forensics after having done your master's relatively easily.
And then would still get you into the doctorate.
Yeah, you can still get into it. It's just how you present yourself.
Okay,
it's very important for you to be able to discuss these things well. Obviously, if you've done a forensic psychology master's degree and you're going for a forensic psychology doctorate, it can be a little bit easier to show how your experience applies. But there's so much crossover between forensic and clinical psychology today that, in my opinion, anyone with a clinical psychology relevant master's degree will have just as easy a time getting into a forensic doctorate if they are just good at talking about it, understand why they're doing it and can convey that, and it's just skill to interview.
Okay, that sounds good. Okay, that makes sense. I think I'm a little bit conscious of the time. There was one question I think which is a little, maybe you could kind of like explain that again. If I want to be like a psychologist who's called into court, right, in a trial, that's either, if I understand it correctly, is either a forensic psychologist who does some kind of risk assessment, or if I'm a non-forensic psychologist, I'm an expert in a certain area, right? Is that kind of like the two cases where you get, or I don't know?
Yeah, I mean, the most frequently used for expert testimony are forensic psychologists because you're used on either side. The Crown will use forensic psychologists constantly. And then private, like defense barristers, I keep saying defense attorneys, I don't know if that makes sense here or not. Anyway, the defense uses us quite a lot too. There's a standard, like prescribed rate that you're allowed to charge. Expert witnesses have government regulated hourly rates. The government regulated hourly rate, I think, is presently £117 per hour that you can charge for your services. And that includes the time that you spend reading the case, writing the report, and attending court, and then they pay travel and things like that. So if you write a report and attend in court, you're probably, for that one, going to range from around like £1,400 to £2,100 for that experience. So when I was doing it, I did 4 a month.
Okay, okay, that sounds good. That sounds like quite a good secondary income there that you generate. Okay, So that's very good. I think, I think we kind of addressed most of these questions. Just from you personally, I think, like, is there something like, I think we didn't really talk about it, and maybe it's like a little bit too, I don't know, like if that's the right time to ask that now, but just like in terms of dealing with, I think, like, I mean, the trauma that you see people going through, kind of still kind of reliving it. It's like, how is that something where, I mean, this would be something I would be really terrified of doing, because I feel like, I don't know how much supervision I would need to kind of handle with that. But is that something where you feel like, okay, that's part of the job, and you kind of, I don't know, like, how do you deal with that? Could you kind of maybe
Yeah.
that?
So we have a variety of different things here. So you've got regular everyday burnout that happens in any career. You can have that in psychology as well, of course. But then you have compassion fatigue, and then you have secondary trauma. And these are just kind of these stair-step levels of impact that you get in doing the work. And secondary trauma is when you start actually feeling symptoms of trauma yourself, phantom pains, difficulty sleeping, panic attacks, breathlessness, etc. It can happen to anybody, no matter how experienced you are. And it's important to understand that in forensic psychology, you will have personal proximity to people who've committed serious offenses, sex offenses, murder, etc. You will be in the room. They don't keep you, secure in these settings either. So somebody won't be like chained to the floor like in TV or films or something. They're sitting in a normal chair. There are probably lots of other chairs surrounding the room, like desks and things. Usually I go into a prison and it's in some room that people have been doing group work in, and there's like a couple of loose desks here and there, a couple of chairs and stuff. So if somebody wanted to attack you, they would be able to. So you got to do two things to protect yourself. One is you have to be particularly good at active listening, de-escalation strategies, and being a calm presence around a person, a non-threatening, calming presence. And then when everything's finished, you have to have very good self-care. Most people recommend, and I do as well, that you have a separate part of your physical space. If you're working from home, like writing up reports and stuff, you do it in a room you keep just for that. I know that's hard to do in the UK, but even if you're working in a shed or you rent out a space to do it in, just keep it out of your house, keep it away from your family. Practice things like mindfulness or meditation, have some exercise routine that allows you to deal with it. Have someone that you can talk to about it. In terms of the supervision landscape, a qualified psychologist usually has an hour of supervision a month, whereas an assistant psychologist will have an hour a week. So in that supervision, you may choose to talk about things like the reflections on your experience and how you felt and stuff. But when you get to a particular part of your career that you don't, my supervisor and I have one, and she has one, and everybody has one. We tend to talk about stuff like our staff, how are they doing, or how are we going to get this contract? We talk about work. We never say, how are you feeling about the latest trauma thing or whatever, because we've just been doing it for so long. It tends to be something we don't discuss anymore. After a while, you develop your own personal skill, and everyone's coping is unique to them. So there's not like a prescribed way of, okay, you just help this person through their traumatic experience. That's obviously going to affect you. I've left sessions before and just kind of shivered from having dealt with that experience, because you have people wailing and crying and screaming in therapy sessions with you, and you have to be really contained, and you divorce yourself from your own emotions in that time. And then when you go back to your emotions later on, you have to deal with that in some way. So have a mechanism to work. Some people write journals, some people do visual arts, some people exercise a lot. But it has to be practical, and you can't run from your experience. You do have to embrace it. It is what it is.
All right. Thank you so much, James. I think I would end this on this is very profound. And I think, I very much agree that we all have to find our individual ways of dealing with stress. I think there's not one route, and like all the research into that topic kind of confirms that. Thank you so much. It's a little bit less fun without clapping at the end or anything like that. There's just, some thank yous in the chat. We very much appreciate it. And I think it was great. And thank you so much for taking the time. And can't wait to see you again next year.
Okay, see you then, and good luck, everyone. Maybe I'll see you in an interview or something. Take care.